Hello, good morning everyone. Hope you're all doing good. My name is Syed Faizan Asnan, and today I'm going to present a topic about mental health and well being among university students. So, let's start my presentation. So, first of all, what is mental health? So, mental health refers to a psychological, emotional, cognitive well being in which a person thinks, feels, and behaves. So, appropriate mental health is highly significant for better quality of life. So, the diversification can be witnessed while analyzing the concept because the concept is different in different culture, community, or society. So, here are some benefits of appropriate mental health among the university students. So, is appropriate mental health is highly effective for their better academic achievement and higher productivity. So, the nature of higher education now is highly competitive globally, that aggravated diverse academic stressor leading to mental health problem among the students. So, therefore, the educational institution and the academic professionals have now recognized the importance of promoting their mental health within the university through different program and activities. Now let's come to the mental health issues among the university students. So the international concern is increasing as the reported deprived of the mental state of the university student is higher as compared to the community peers of the similar age group. So educational professionals have identified the impact of deprived mental health on the learning and the academic achievements of the students. So a lot of health concern and the consequences are witnessed among the university students. So what are the common mental health issues among the university students? So first of all, let's talk about interpersonal problem. There are many problems, like the first of all is interpersonal. The second is the destructive behaviors, mood disturbance, and similarly depression, anxiety, stress, and eating problem and other psychological issues are also common among the university students. It is also evident that depression and the anxiety cases have worsened as the university student progressed to their subsequent to their second, third, and the last semester. So let's come to another contributing factor. So what are the contributing factor to these stressors? So certain stressors contribute to the development of mental health concern among the university students. So evidence-based studies have identified that institutional higher expectation in terms of grading achievement, frequent project submission, and managing deadlines have resulted in the development of depression and stress. Similarly, another contributing factor is socio-economic condition. So when we talk about the socio-economic condition, it's another leading cause of the mental health issue among the university students. Because the students who belongs to low socio-economic status are generally forced to compete for the scholarships, or they work with the study to meeting with the institutional expectation, and such conditions are also associated with vulnerability of depression, stress, and sleep deprivation among the university students. So furthermore, fulfilling the educational cost and maintaining study hours are correlated factors leading to deprived mental health. So let's come to the global assessment about the mental health issue among the university students. So mental health issue among the university student is a serious concern across the globe. So when we talk about, a survey has been conducted which shows that globally the survey has been conducted among 23 countries, which reported that average prevalence of depression among university students is around 20%. So when we talk about American, one second. So when we talk about when we talk about United States of America, a survey was conducted by American Psychological Association in which mental health of the university student is identified as growing concern The survey identified 41% of the students were suffering from anxiety and depression. And when we talk about Australia, so it shows that 65% of the Australian students are in the psychological distress. However, 35.4% of the students were having thoughts of suicide. So this is not good for the students. Come to the next. So when the survey was conducted in Canada, it shows around 46% of them were severely depressed, and when we come to the subcontinent side, the statistics shows that among Indian university, the ratio is different. 37% of the university student were suffering from moderate, severe, and extreme depression, respectively. So when we talk about Saudi Arabia, it shows that 21% of the students were found depressed, and 24% have panic and anxiety related symptoms. Therefore, it can be said that the mental health issue among the university students are global concern, and mutual interventions and policies are required to address these issues. So let's come to the consequences. So what are the consequences of these stress? First of all, the consequences of the deprived mental health among the university student is also diverse and have a huge impact on the different aspects. Not only on the health of the student is affected, but there are numerous consequences of poor mental health. Poor academic achievement is one of the key consequences that may affect the studies, and social hurdles which applying for the employment, medical assistance in the chronic mental health issues, and self-harm, suicidal thought. These are the consequences. And let's come to the public health implication. What we as a public health practitioner do for the betterment of the society. So let's come to the public health implications. So public health implications, first of all, the most important is counseling session. As a public health practitioner, we play a key role in addressing the mental health issue among the university student through counseling session. Counseling sessions are mainly arranged within the university campus to address the underlying issues. Counseling is helpful for the students to share their experience and thought with the counselor and address the condition of depression, anxiety, and distress. Similarly, counseling sessions are also beneficial for the students to overcome their negative thoughts and resume their academic achievements. Now the second one is organization of the extracurricular activity. So another public health implication is related to the organization of extracurricular activities inclusive of sports, events, picnics, and different workshops. So extracurricular activity are associated with the better academic performance. Now talk about the third one. So the individual or the group therapies are commonly identified as the key public health implication for the university students. Supportive and psychodynamic therapies are used to the individual level in addressing anxiety and stress related issues. Similarly, group discussions are mainly arranged to engage students in valuing their beliefs and thought. In such ways, these therapies are also helpful for the students to get rid of the depression, distress, anxiety, and all of these related symptoms. So, and the last one is health promotion program. We should arrange such programs with the different communities from the university students to address their psychiatric stress related symptoms, and these all could help in the better outcome. So in conclusion, it is said that the prevalence of mental health issue among the university student is extremely higher. And what are the symptoms? That the depression, distress, anxiety, sleep deprivation, these are the common symptoms. These are the common mental health issues among the university students. So institutional expectation, what are the causative factors? The institutional expectations, socioeconomic factors, fulfilling the educational cost and maintaining study are the most common stressor. Poor academic performance resulted in the poor academic performance, failed careers, low self-esteem, self-harm.
So at last, counseling session, health promotion program, extracurricular activities, and the group therapies are the most effective implication which we can use to address all of these concerns. So thank you.